Okay, so welcome back everyone to Pre-Dental Universe. We have Dr. Daniel tonight with us. He's a general dentist and he will be sharing some advice and his journey with us as a dental professional. And let's get started.
All right, so thanks again for having me here. We just did a test run and technical difficulties being what they are. So I appreciate you guys being patient as Sherry gets this all squared away for us. So I have the chat bar open. So if you have questions along the way, go ahead and type those out for me. A couple years ago, a couple years ago, I started a podcast, Anything But Dentistry. Um, a lot of what we do in dentistry, I think the difficult parts are not the actual dentistry per se, but dealing with team, dealing with patients, the interaction, the marketing, the presentation of treatment, discussing all those options with people. The actual doing of the dentistry is actually one of the more simple things in my day. Um, I got my start in Cleveland, Ohio. I went to dental school at Case Western Reserve University. And before then, I did my bachelor's at the Cleveland Institute of Music right down the street. Um, the reason I made the change was in part due to the fact that I grew up in my dad's dental office. He's a general dentist in Michigan. My brother is also a practicing dentist in Michigan. Um, Along that journey, I met through connections. Did you guys hear all of that? Type yes if you did. Um,
Yes.
okay, perfect. All right. So the Pankey Institute is a continuing education center in Key Biscayne, Florida. And essentially all of my mentors, all of the people that I um, love and adore in dentistry have had some involvement at the Institute. And when you complete your curriculum there, you get a pin, and this is a photo of my pin, and on the middle it says quid pro quo, which in this recent political climate we've heard quite a bit, meaning, if I scratch your back, you'll scratch mine, and vice versa. I prefer to use the definition, to whom much is given, much is expected. So I am here talking with you today primarily because of the giants who allowed me to stand on their shoulders and be able to visualize things that I couldn't see before that. So that's made a huge impact in my life. And whether you decide to specialize or stay a general practitioner, the Pankey Institute is a phenomenal place for you to pursue continuing dental education after dental school. That is, in fact, where I met my mentor, friend, and senior partner, Dr. Bill Gregg. He's the reason I'm here in California. I initially started practicing dentistry in Cleveland right out of school, buying a practice. So about, 5 years ago now, probably 6 or 7, we started a conversation about me coming out to California, him slowing down and taking over his practice. So we made that move in 2016, and I've been here since. It's been spectacular. It's not where I thought I was going to end up with my career, but here we are, and we're loving it. Um, One of the things that's going to be, in my opinion, a battle for you in your generation is social media. Um, it is a huge distraction. It is can be used as a very positive thing, but it must be used in a very conscious way. Why? Because it takes up a lot of time. Um, I was just looking at my statistics, and I'm spending less than an hour on social media these days. And at one point in my life, it was much more than that. So if you can curtail that and use it only for positive interactions, you can actually buy yourself a lot of time, which is going to eventually save you a lot of money, because you're going to be able to put efforts into things that are going to get you further along. I highly recommend this book for all of you, especially in your positions right now. And we'll get into more of why this is, but there is so much more. You have to work hard, I suppose, to get the positives out of social media. There's more negatives that will come through than the positives. And at this point, I would like to sort of move to determining and talking about your goal. You're all here because you're trying to figure out what dentistry has in store for you or what it has to offer to you. And what I can tell you is that there's always room if you're good enough. There's zero competition at the top. And the beautiful thing about dentistry is that you have control over what you do. You have control over who you do it on, and how and what methods and how you want to take care of people. And in my opinion, that is something that very few professions, especially in medicine and those that can offer. So to have complete autonomy over the way you do business and the way you live your life is incredibly powerful. But again, that comes with much responsibility. So by surrounding yourself with people that believe in you and people that believe in the work that you're doing, it's incredible. And there's a quote, do what you love what you do, and deliver more than you promise. And I think if you strive for that, you're never going to be disappointed. So for you all, what is the goal? And how do you determine what your individual goal is? So I, in my opinion, think you should be looking and trying to figure out what it is that you love as soon as possible. Not what I love, not what Instagram loves, what you love. And if I were in your shoes right now, I would be calling any dentist or dental professional within a reasonable drive and reaching out to them to see if I can watch them for a half a day, for a whole day, and seeing as many, because we have that autonomy, as many dentists as there are in the world, there are dental practices and styles of practice. So if you see one specialist that you love and you think you want to do surgery, for example, you may find that you visit another oral surgeon and you despise the way they practice. It really turns you off. So you need to see, or if you think you don't like surgery, you may have visited the wrong oral surgeon. So do some research about the offices. Ask to speak to the doctor to get the shadowing opportunity. Usually the front office person is there as a bodyguard. My front office person, Jenny, is the defender of my time. So her job is to make sure that the only people that get to speak to me are the people that absolutely have to speak to me. So you need to get past that front office and speak to a dentist to be able to get into the practice to observe what they do. And if they love what they do and if they're happy doing it, usually they also feel the same responsibility of giving back. So once you're there and getting as many days as you possibly can afford to figure out where you want to be in dentistry, make sure that you keep your eyes and your ears open. Carry a notebook, something small, Moleskine or a field notes journal book. And make notes of your questions and observations and gut feelings. A lot of times it's not appropriate to ask a question mid-procedure, but it's an important question for you to ask and have answered. So by writing it down and making sure you're making those notes, you can then go back and have those questions answered. And you can have them answered by other people as well, right? So why did the surgeon do this and that? Why did the periodontist use a laser in this situation? What's the benefit? Whatever your questions may be, And listen, there's so much more to the practice besides the actual dentistry, like I said earlier. So paying attention to how the office handles financial transactions, paying attention to how the office appoints people, how do they answer the phone? These are all questions you're going to need to figure out for yourself in when you're designing the practice of your dreams. What's the other benefit of seeing so many specialties? Well, if you have the idea in your mind, the vision that you want to be an orthodontist, well, as you are now in undergrad, you can look for dental programs that have lots of exciting research going on in orthodontics. For example, Case Western Reserve University is located in very close proximity to the Natural History Museum in Cleveland, which has the largest collection of human skulls in the country. So there are research programs at Case Western Reserve University that are heavily associated with orthodontics and the advancement of that specialty. So as an undergraduate student there, you will have access to those types of opportunities. If you know you want to be an orthodontist, you can strategically apply and pursue these things at those programs. And preference, you may choose to go to one school over another because of those opportunities. And ruling out specialties is just as important. You don't know that you dislike pediatric dentistry until you've seen it. So those are very, very important things for you to think about. Once you're in dental school, you then have different choices to make. I knew that my vision for myself was to be a restorative dentist. What did that mean for me during my first and second years in dental school? It meant that I didn't need to study as hard for the boards. I needed to pass, I needed to pass my exam. I didn't need to do exceedingly well so I could be competitive when applying to a specialty. That was my vision for myself, and therefore I could make those choices. So if you do know that you want to specialize, not only can you work really hard on your boards, but during your off time, you can spend time developing relationships with specialists that are in your vision and in line with that vision. So I know that's a lot to do in the middle of studying for your DATs, but I would argue that it is just, if not even more important than that. The other thing that's really important to remember is that all of you coming into dental school look a lot alike. So there's not very many of pre-dental students that are coming in with conviction and understanding about the profession. Dental schools don't want to just accept the best and brightest undergrad students. They want to accept the people who are going to impact our profession the most. They are also looking to see who they can graduate. They do not want to have liabilities in their department, right? They don't want to have liabilities in dental school of people that they're going to have give a lot of assistance to help get them through the program. So differentiating yourself as a student through a lot of this is very, very important. So I told you that I was a musician. I spent a lot of time actually in the dental school before I was accepted into dentistry. So I started walking into the dental school asking if I could hang out at the school. I wanted to make sure that Case Western Reserve University was a good fit for me as a dental student. That turned into me working in the Department of Radiology at the dental school, which turned into me working as a treatment care coordinator for the Department of Oral Surgery. What did that mean when I applied? Everybody knew who I was. So I often joke that I got into dental school through the back door. So I didn't look like one of the herd. I looked like I was already a dental student. These are situations that you can create for yourself. These are opportunities that you can make available for yourself by virtue of making connections with other professionals, specifically in your area, because that's the first place you're going to get, you know, in-person experience. These types of virtual events are fantastic. I think really where your time is best spent is in an office of a dentist in your area. So my favorite thing to do in general dentistry is what we call as dentists interdisciplinary care. I like being the coach. I like being the quarterback. I like doing the planning. And so what I'm going to share with you today is treatment that we completed for a patient. And she has been a patient of this practice for probably 15 years. And she was unhappy with her smile. She finally got to a point where she wanted to do something nice for herself. And so when I look at these things, I'm looking at the lips frame the teeth, the lips frame the smile, the gums, all of that. I see chipping, I see unevenness. Can I correct this with dentistry? Absolutely. But is that what's best for this patient? We have some spaces. How is that tooth going to look if I just make it slightly bigger? It might look okay. There's spaces other places. Honestly, when we looked at this, I thought that we might do better for her. We may be able to do less dentistry if we actually completed orthodontics. And so that's what we did. So we started, I wanted to share this with you too. This is an important thing once you get into dentistry. One of the most important things about clinical photography is that you make sure that your batteries are charged, because you'll see when I show you some pictures here, my batteries gave out and the pictures are quite dark. We decided to work with an orthodontist, and I gave him a prescription. Don't line up the edges of the teeth. Please line up the gum heights so that we can give her a pretty smile. And as you can see, the right picture there is quite dark. And so that's what we did. We put her in braces as a 55-year-old. Why? So that I could do less dentistry. I could take away less tooth structure. I could be more conservative. And so this is where we ended up. Spaces are closed. And then we were able to go through and put on restorative materials. Now, when I'm thinking about doing dentistry, veneers, crowns, specifically, we did veneers in this case, and we had talked about doing veneers on top and some veneers on the bottom. I have choices to make. I can choose composite, which is beautiful. Instant gratification, very conservative. The downside is it's a little less strong, and it's more likely to stain and lose its polish and shine over time. Feldspathic porcelain is beautiful, incredible translucency, not as strong, and cannot do quite because it's so translucent, where it's difficult to do a shade, a color change. Lithium disilicate, now we're getting into a material that has some of the properties of feldspathic porcelain, where it is translucent, but it has a significantly increased strength. Zirconia, we get more and more strength here, but we give up some of the translucency. And then gold is obviously not translucent at all, and it is either white or yellow. So from composite being the weakest and gold being the strongest, I get to choose and make decisions here about what we're going to do. And we made a decision to go with a combination here of lithium disilicate and composite. So the bottom teeth I bonded with composite, And the upper teeth I bonded on some lithium disilicate veneers. And the result is stunning. It's fantastic. I partner with great people to be able to get this done. My lab is fantastic. My ceramist and I have conversations all the time. And I have conversations with my orthodontist. That's the only way for us to be able to deliver treatment at a really high level. Conservative dentistry that is going to last for a lifetime, I hope. So that's what we have. What other questions can I answer for all of you?
Well, thank you so much, Dr. Daniel, for your presentation today. We can start taking questions. So if you guys have any questions, be sure to leave them in the chat so we can ask.
Oh, Mohammed asked how long this took. So this was a period of actually a year and a half of braces. That's a great question. And thank you for asking me that. So she was in orthodontic treatment for a year and a half. If any of you have had ortho, you know how that is. She experienced dental burnout. Dental burnout. She did not want to go through with treatment. I forgot to share that with you. So after she was done with her orthodontics, when we got to this point, she was thrilled. Everything was in line. Yeah, there was some chipping, but she was good for now. It was a huge improvement for her. And then in February of this year, right before COVID, she decided, and her husband were selling their house and moving to Tennessee. Would I please finish treatment? And so from that point on, so from that picture on the right to this final picture here, took 4 weeks. That's a pretty quick turnaround. We were able to achieve that because we had lots of planning in advance. So we had plenty of records, very thorough documentation, and really clear communication. So we were able to execute for her very fast with that final treatment. My work-life balance, Ana Noriega, thank you for asking that question. It is always in a state of change. So in one of the things, the first tenets, first lessons, main staples of the Pankey Institute is this: know yourself, know your work, know your patients, apply your knowledge. And that's taken from the cross of life, which is work, play, family, and worship. And so we're in the middle of this, and I don't believe that any of us are perfectly balanced. We're always leaning towards one stage or another. So right now in my life, I'm definitely leaning towards work. I am in my early 40s. It's important for me to be a producer for my family. It is the time for me to be finishing paying student debt and all of that. It is time for me to be building savings. My significance, the hardest thing for me about COVID was I couldn't work. So when our practice shut down in March, I was at home getting really anxious that I wasn't contributing to my community. So I am always working on my balance, and I love what I do, which really helps. So, but yeah, I think there's never enough of me to go around, and that's that decision. You have to go through a decision tree to figure out where your time is best spent. So, and I feel very, very fortunate to have been provided the opportunities to be where I am. To whom much is given, much is expected. That's why I love doing things like this. I actually have 2 interns in my office at the moment now that are observing, and learning from us. Oh, you're also welcome. Thank you. Thank you. Be sure to reach out. I did join your group chat, so if any of you want to ping me there, I'm happy to do that. And if any of you are in Southern California, we are here and I'm happy to have you visit.
Do we
Hannah
have any more
yeah,
questions? I'm not
yeah.
seeing the chat for some reason.
So I'm seeing Hannah just asked, do general dentists do a lot of teeth whitening or do we refer that out? You know what? A lot of patients are just doing that online these days. We offer it in our practice. The take-home kits are so effective that I'm not doing much in-office whitening anymore. The cost to benefit ratio just isn't there. So we use Opalescence Go. It's a take-home tray kit that we do. And that's part of I do a lot of it. I prescribe a lot of it. It comes almost before every restorative case we do, or at one point during that case. Anybody that's going through Invisalign or straight, clear aligner therapy with us, they will bleach their teeth during that treatment. So yeah, it's all over the place. And anybody can do that. Again, that's because the reason I love bleaching teeth is because that allows me to do less dentistry. So when we're preparing veneers, let me go back to this. You notice these wrap over the teeth quite a bit. So that's a visual of the teeth, and they wrap over her teeth quite a bit. That was in part because there was some color variation that we needed to block out. She wanted to make an even colored transition, and the easiest way to do that was with a slightly thicker amount of ceramic, which means unless we want to give a patient horse teeth, I need to actually drill more tooth away. So if we bleach them, we can achieve that same color change without drilling and taking away so much tooth. And what advice would you give to your younger self? Wow, in what regard? There's so much. First of all, don't take yourself too seriously. Second of all, don't worry about what other people think of you. You have to, if you can spend time knowing yourself as well as you can, then the decisions you make will be in line with that. So, and that goes back to my first point about getting off of social media as much as possible, to avoid any of that influence that may take you away from your own personal values. So if the better you know yourself and understand the vision of where you want to be, the more in line with those visions your decisions going to be. And so I think that's probably the advice that I would insist on. There are claims of high living and practicing expense in California. Oh my gosh, yes, claims? No, that's fact. It's very expensive. So for example, I left Cleveland, Ohio, moved to California. My employees here get paid almost twice as much as they did. No, they get paid more than twice as much as they did in Ohio. So there's certain expenses that are definitely higher here for sure. There are things that aren't. For example, the beach is free. Surfing is free. So you can't really do that in the winter in Cleveland, Ohio. So yes, there's, they call it the sunshine tax, and there's a high cost of being here. The other effect that living expenses here have had on us in California is I'm still renting. Our family is still renting our home. So but that's fine. That's okay. We have a safe place. It's great. And But there's a lot of those problems in California for sure. There are 6 dentists in my building. There's lots of competition here, competition. I say that in quotes because there's only one me here in California. So you can get a crown anywhere, but you can't get a crown done by me. So, what do we sell as dentists? What do we sell as medical professionals? Really, it's trust. That's the only thing that we're selling, in my opinion. Do I feel like, here's a question Hannah's asking, do I feel like I work the most with orthodontists or other specialties as well? So again, I think, I'd like to say that we're unique. I work with oral surgeons, periodontists, and orthodontists primarily. And I refer to them a lot. Most commonly, general dentists are the quarterback, and I refer cases and treatment plans out to the specialists. In our practice, it's actually very mutual. So I actually see a lot of patients that are referred to me from oral surgeons and periodontists. So I work closely with, I don't know, 4 or 5 specialties here. And what is something I wish I did differently in dental school? I was pretty true to myself. When I was in dental school, I was married. I did not party as much as my classmates. I networked quite a bit. I explored all of the specialty opportunities, and I ruled all of that out. So I don't know that there's much that I really wish I did differently. Maybe investigating and developing a better relationship with some of the restorative doctors in our school. I graduated in 2009, right at the peak of the great financial crisis. So I spent my senior year scrambling for a job. Financially, I wish that I had taken a military scholarship. But I don't know where that would, I may not be where I am today if I had done that. So those are great questions and things that I ponder. But I don't have any regrets. And if that's that, how did I prepare for the DAT? So Sherry asked this. I did take one of the courses, I believe it was Kaplan, and I had through them 3 different practice exams, complete practice exams with answers. And I studied 2 subjects per day for 90 minutes each, and I rotated through my subjects. So I don't remember quite what they are now. And then I took one of the practice tests. When I took that practice exam, I made note of the ones that I had trouble with, studied those, worked on that, and then I took the second practice exam. I compared my notes for those 2, and I actually had difficulty with a certain set of problems. It's really important to remember that there's only so many questions that they can ask you on that exam. There's only so many styles of question that they can ask. So they figured that out really well. So there's going to be certain problems and certain things that they want to know. If you take enough practice exams, you're going to figure out what those are. And you may have problems with a different set of those questions. I had a problem with a certain group of the biochemistry questions, and some of the biology stuff. So working on that helped me get through that. And my background, not being a dentist, not being a biology major, not being a chemistry major, I was a unique person. And I honestly do believe that spending my time in the dental school really did help my my ability to be accepted into dental school. Absolutely. So knowing, having everybody be familiar faces. So I knew most of my faculty, a lot of the people that were on the admissions board personally by the time that I was applying. So that I think had an impact for sure.
Okay, do we have any more questions?
One more question is, are there any other skills that we should work on to get better at dentistry, like manual dexterity? So this is an interesting question from Hannah, and that reminds me of the one class, because I was a musician, right? So I took, and I didn't go to university. The Cleveland Institute of Music is a conservatory. So I took music history, not general history. And I had to take one elective only per semester. And I took things like modern dance. I mean, all I did, I skipped class to go practice. So I was not a great dental student. I was not a great student in my undergrad. I barely scraped a 3.0. So for me, the one regret that I had and one skill that I wish I would have taken is more art. So sculpture, and what I do with my work, I'm using my hands all the time. I am sculpting every single day with my drills and with my instruments. So taking a sculpture class, taking a drawing class, being able to visualize what you want to communicate before you put it on paper, developing those skills is phenomenal. The other thing that I used throughout dental school, still use it today to hold on to things, is a program like Evernote, where I can keep everything and be able to search through things. So having a system for, if I encounter a research article, I can save that really quickly and efficiently so I'm not forgetting it. And then I can search for it later. Yeah. Any last questions? Oh, you're very welcome.
Okay, well, I would like to thank you once again, Dr. Balaze, for your time tonight. Very helpful advice, and I'm sure a lot of us found this very helpful. I will go ahead and send the post-quiz link in the group chat as a verification that you've attended this session. And if you have any other questions, please feel free to contact Dr. Daniel. He'll be happy to answer any of your questions.
Totally. Thanks so much.
Thank you so much for